Thanks, Dudley. Sorry, I was on mute, obviously. Yeah, I'll take a moment to just introduce the suite of different ICs that have been tackled by my colleagues listed on this slide. Yemi, Christina, myself, and Garrison. And these are, if you go to the next slide, investment cases that are in various states of development. So the tobacco control ones have obviously been going on for a few years now and have been done in a number of countries that you see reflected on the map. And a few others are kind of nascent in being developed, tested, and then pushed out to more countries as the product is kind of tested and refined. So these are, alongside those tobacco control investment cases, road traffic safety investment cases, which are being led by my colleague Garrison, the NTD investment cases by Yemi, and the household and ambient air pollution investment cases by Christina. As you look at this, you can see that we've also tried to expand some of the work on the NCD investment cases, most recently in Guyana, where we paired together kind of the base NCD investment case, tackling the main risk factors and the primary NCDs, and then also incorporating several mental disorders, neurological and substance use disorders, as well as for the first time adding in suicide prevention interventions. So kind of the most complete investment case to date from our end, and we're excited that it's kind of come together in one package. And I think it speaks to that effort we were talking about earlier to begin to pull everything together and work towards something resembling a universal healthcare investment case. In a couple of these countries, also been multiple investment cases conducted. I think, as colleagues on this call probably know, to some benefit, with that deepening knowledge, creating more evidence, more pathways, and also creating challenges as well. As conflicting evidence is produced, you're using different models that are producing different answers, and then you have two different sets of numbers in some cases. So challenges and opportunities there to align different models that are used across the cases. I think we'll start, if we go to the next slide, with tobacco control. Next slide. These are, as we mentioned earlier in slides, there's about 36 FCTC investment cases that have been conducted. They're in various states of implementation. There it is. Thank you. In like 24 of those countries, they're completed. They're out, released. There's 12 that are still pending, and a new tranche that are still going through review. In those first 24 countries, the average tobacco burden as a percent of GDP was about 22.4%, ranging from 0.5% in Chad to 6% in Jordan, and the intensity of that burden or lack thereof correlating with rates of tobacco use in those countries, and then to some extent country income status. Probably obviously across those countries, nearly without fail, tobacco control measures were demonstrated to have a return on investment above 1, with some exceptions for offering brief advice to quit at the primary care level, depending on the context, and oftentimes depending on kind of initial or baseline quit attempt rates in that country and rates of presentation at primary care centers. We've had the opportunity to kind of share some of this work in many different formats. There are 4, I think I actually should say 5 journal articles that have been published or currently in development. One was as part of the special issue on tobacco control celebrating PAHO's 100th anniversary. That kind of was a deep dive on lessons learned from 4 countries in the Americas, and exploring with the voices of partners in the ministries of health in those countries, how those countries have used the investment cases as well, which was interesting. And then there's a package of additional publications that we're going to put out to summarize results from the investment cases. Another article will detail the methodology. There is one on sort of the equity implications of tax increases. And then Roy Small at UNDP is also putting together something to encapsulate the institutional context analysis and findings there. We've also presented at a few public fora, including the World Cancer Congress and the the sixth Global Symposium on Health Systems Research. So it's been fun to kind of share this and make sure that it gets the findings are represented internationally. And then finally, countries are using these findings to position as tobacco control as a priority, a sustainable development priority, to strengthen responses through expanded alliances. We've seen the results placed in strategic plans, in briefing documents. So we can talk a little bit more as we move through. On the next slide, just briefly on the methodology. So this is a standalone RTI developed static model using a population attributable fraction approach. So basically just to say that the model itself is holding most parameters about the world static, population is unchanging, and so forth. But we are then sort of looking at what happens if you just use that static population, what happens if you reduce tobacco control in it. And the population attributable fraction approach is then saying, if you have a 20% relative reduction that's being applied from tobacco control measures, what happens if that is applied to tobacco attributable deaths? So it's in sort of exact proportion. The epidemiological data is usually without fail coming from the Global Burden of Disease study conducted by IHME. Just a few countries have done country-specific studies on tobacco attributable fractions of deaths for various diseases. And in that case, we've kind of adapted or applied those to GBD data, or in some cases used them directly. The economic losses due to tobacco attributable ill health are from published studies, so we're relying on Mark Goodchild's work for the population attributable fraction of smoking healthcare expenditures to estimate healthcare expenditures due to tobacco use. Estimates of productivity and absenteeism are from meta-analyses of studies that have looked at the question of how the extent to which tobacco use reduces productivity in populations worldwide. The impact of tobacco control measures are from the WHO appendix, and financial costs of actually implementing and enforcing the interventions come from the WHO NCD costing tool. Just want to note that we've also, in a couple of cases, developed kind of sub-modules to examine other questions that are of interest to countries. These include estimating the equity impact of tobacco and the extent to which increasing taxes can improve equitable outcomes, and then also revenue impacts as well. If we go to the next slide, focusing on challenges and lessons learned. One challenge has been, kind of understanding how comprehensive the costs that we have access to, the tools that we have access to estimate costs. How comprehensive those are. Do they capture everything that it takes to implement and enforce tobacco use? We're extremely fortunate to have that framework from WHO, the WHO NCD costing tool, which I think is really one of the very few attempts to cost policy measures, and it's been huge as part of the application of this work. We've been exploring a little bit around for FCTC as part of a funding gap costing project, adding to those costs, looking more extensively at operational costs for quit lines and fixed costs of putting them in place, brief advice, the same, enforcement costs, talking to enforcement specialists at the union, getting in touch with the chief enforcement officer in Ireland to see if we can develop some frameworks for making sure that what are extensive parts of tobacco control, going into retailers and making sure that things aren't being sold to underage children, or that the advertising concerns are also managed, seeing if we can account for those to some extent and make sure that we're being inclusive. In terms of lessons learned, I think there's an appetite for conducting these analyses and for capacity building. In a couple of cases, in Colombia, we worked with the Economics Institute to share the methodology. In El Salvador, we met with Ministry of Health officials. In Zambia, we went to the University of Zambia and presented findings and the methodology as well. So I think that there's truly an appetite, and we heard a little bit about that from others for taking the methodology and using it to update studies in the future or conduct new ones. To that end, we are moving towards opening up the tool and creating a publicly available Excel-based version that anyone will be able to use and apply. And then I think another lesson learned is that pairing these investment cases with technical implementation assistance can be a huge help to fulfillment of desired policy outcomes. And I think for this group, the question would be, how do we think about making the investment cases a part of a larger package of implementation assistance? And I say this using the example of Suriname, where they had an instance, I think, where there was a proposal from one part of the government to revamp the tobacco tax structure in a way that would have been detrimental, I think, to the income, to the revenue producing effects of it, as well as the health implications. And they used the investment case as part of their argument. The Ministry of Health did in meeting with, I think it was the Ministry of Finance. And then alongside of having that evidence from the investment case, there was technical implementation assistance that went right alongside that was available from FCTC as part of their FCTC 2030 project. PAHO was there in those meetings. And I think the synchronization of the investment case findings with that technical implementation, you could see it kind of working together, and with the evidence kind of opening the door and the implementation assistance, being there to help somebody walk through it. So I think there's some thought we can put into how we pair things together. And then just as a final note, we've seen that these have been used in really unique and innovative ways. They've been put in strategies and plans. They have contributed to discussions in parliaments when tobacco control measures are present. And I think, we would benefit from a holistic accounting of those as part of the effort for the journal article that we did for the PAHO tobacco control special issue. We spoke to those Ministry of Health officials. They shared some really neat things. And I know Roy, again, is reaching out and has a survey that he's going to seek to kind of tally some of these things and understand the way that governments have been using them. And for us, I think that, could be really useful in the beginning stages as we're engaging country partners to be able to show, here are some of the ways these things have been used, generating excitement, showing the pathway for what the final product can do, and incorporating that in part of our process may generate some greater engagement levels from individuals, country health authorities prior to the analyses themselves when we're gathering data.